Due to the COVID-19 pandemic, the world stops. At not the determination of the loss to be a registered professional. Welcome to our online quiz.
Hello nurses! Welcome again to our online quiz. Ang topic natin ngayon ay sa Nursing Practice 2. So it is all about pediatric nursing and ang pag-uusapan po natin ay ang tonsillectomy under pediatric nursing. Okay, so let's begin with a situation. A child is scheduled for a tonsillectomy in a day in the surgical unit. Okay, so question number 1. A child is scheduled for a tonsillectomy. A nurse plans care knowing that which condition would be a priority because it presents the highest risk of aspiration during surgery. A. Presence of loose teeth. B. Difficulty in swallowing. C. Bleeding during surgery. Or D. Exudate in the throat area. So, ang tinatanong po dito sa ating question number 1 is kung ano yung magiging priority mo kapag na-assess mo ito na magbibigay ng high risk for aspiration during surgery. Okay? So, is it letter A, presence of your loose teeth, B, difficulty in swallowing, C, bleeding during surgery, or D, exudate in your throat area? Okay. So, elimination technique, una nating tatanggalin dito yung difficulty in swallowing. Okay? So, difficulty in swallowing, nahirapan daw siyang lumunok. So, take note, these are incorrect because these are characteristic that may indicate the need for surgery. So, ito yung indication for surgery. So, hindi yan yung ating sagot. So, next na i-eliminate natin dito is yung option letter D, the presence of exudate in the throat area. Why? Kasi same lang po siya ng difficulty in swallowing. These are characteristics that may indicate the need for the surgery. So, hindi po yan yung ating priority for the risk of aspiration during your surgery. So, ang natitira na lang dito is yung option letter A at saka option letter C. So, alin sa dalawa ang sagot? So, itong si option letter C, bleeding during surgery, okay? Bleeding during surgery will be controlled, okay? Pwede natin i-control yan yung bleeding during surgery kasi pwede natin i-control yan via packing and suctioning as needed. So, hindi po yan yung ating priority. So, our priority here is letter A, the presence of loose teeth. Why? So, in the preoperative period, okay, the child should be observed for the presence of loose teeth to decrease the risk of aspiration during surgery. Okay, so pag meron po siyang naugang ngipin, kailangan pong i-notify yung ating surgeon kasi baka ito po ay maging at risk for aspiration. Okay, so letter A is the correct answer for question number 1. The next question number 2. The nurse is caring for a child after tonsillectomy. The nurse monitors the child, knowing that which finding indicates the child is bleeding. A. Frequent swallowing. B. Complaints of discomfort. C. A decreased pulse rate. Or D. An elevation in blood pressure. Okay, so ang tinatanong dito is yung nag-indicate na yung bata ay nagkakaroon na ng bleeding after your tonsillectomy. Okay, so is it A, frequent swallowing, B, complaints of discomfort, C, a decrease in pulse rate, or D, an elevation in blood pressure? Okay, so take note that your elevated blood pressure and complaints of discomforts are not indications of bleeding. So letter B and letter D are not indications for bleeding. So eliminate letter B and letter D. So, is it letter A or letter C? Okay, so letter A or letter C na lang ang natitira. So, in your number 2, the correct answer here is letter A, frequent swallowing. Okay, so in tonsillectomy, it is the surgical removal of the tonsils. So, frequent swallowing or clearing of the throat, okay, are signs of bleeding. So, bukod pa sa ating frequent swallowing or clearing of the throat, yung restlessness, fast and steady pulse, and vomiting of bright red blood are signs of bleeding. So, letter A is the correct answer. So, it indicates that there is a bleeding. So, kapag siya ay lunok ng lunok, i-clear po niya yung kanyang throat. So, merong bleeding na nagaganap dito. So, letter A is the correct answer. Next, number 3. After a tonsillectomy, a child begins to vomit bright red blood. the nurse should take which initial action? Okay, so number 3 question is your initial action when the child vomits bright red blood after tonsillectomy. So A, maintain NP2 status. B, administer the prescribed antiemetic. C, turn the child to the side. Or D, notify the physician. So, as a nurse, what is your initial nursing intervention here? Okay, so nagsuka ang bata. So, anong ating priority dito? So, our priority here is your airway. So, we must prevent aspiration. Okay, so we must prevent aspiration. So, your initial action here as a nurse is letter C. Although yung letter A, letter B, and letter D ay gagawin talaga natin, so hindi po yan yung ating pinaka-initial action as a nurse. So as a nurse, we must turn the child to the side. That is to prevent your vomitus to be aspirated by your child. Okay, so yun po yung ating pinaka-initial nursing action. It would be to turn the child to the side. The next question, number 4, after tonsillectomy, the nurse reviews the healthcare provider's post-operative prescriptions. Which prescription should the nurse question? Okay, so alin dito yung negative for the patient? Okay, yung dapat hindi prescribe ng physician para kay patient. Letter A, monitor for bleeding. Letter B, give no milk or milk products. Letter C, suction every 2 hours. Or letter D, give clear, cool liquids when awake and alert. So, which of the following prescription should the nurse question? Okay, so after tonsillectomy, okay, suction equipment should be available. But take note, nurses, suctioning is not performed unless there is an airway obstruction because of the risk of trauma to the surgical site. So itong letter A natin, monitoring for bleeding is an important nursing intervention after any type of surgery. Okay? So, tama pong prescription yun ng doctor. So, letter B, tamang huwag tayong magbigay ng milk or any milk products. So, milk and milk products including yung pudding, okay, are avoided initially because they coat the throat and it may cause the child to clear the throat and increase the risk of bleeding. So, take note, yung ating diet dito after your surgery is a clear, cool liquids. Okay, so after your tonsillectomy, clear, cool liquids should be given. Okay, so iwasan nating ibigay yung mga citrus juice, carbonated, and hot or cold liquids. So it should be avoided because they may irritate the throat. And bawal din magbigay ng mga red liquids. Okay? Yung mga cherry Kool-Aid natin, bawal po yun. Okay? Red liquids should be avoided also because they give appearance of blood. The next question, number 5, the nurse is reviewing the laboratory results for a child is scheduled for tonsillectomy. The nurse determines that which laboratory value is most significant to review. So, ang tinatanong is yung most significant laboratory value to review. A, creatinine level. B, sedimentation rate. C, prothrombin time. Or D, blood urea nitrogen level. Okay? So, take note, nurses, that in the tonsillar area, it is so vascular. So, ang pinaka-concern natin post-operatively is about bleeding. Okay? It's all about bleeding. So, take note that prothrombin time, partial thromboplastin time, platelet count, and hemoglobin and hematocrit count, and also with your white blood cell count, with the urinalysis are performed pre-operatively. Okay? So, the prothrombin time results would identify a potential for bleeding. So, the correct answer here is your prothrombin time. So, letter C is the correct answer. Okay? Because creatinine level, sedimentation rate, and the blood urea nitrogen would not determine the potential for bleeding. So, hindi po siya makakadetermine kung duduguin yung patient mo after your surgery. So, the correct answer here is letter C, prothrombin time. Okay, so next, yung keyword natin about tonsillectomy is your tonsils. Okay, so T for turn to side. So after your surgery, kailangan i-turn to side natin yung ating patient. Side lying or prone position yung ating patient. Then observe for bleeding. And letter N, no to milk and milk products including your puddings. And letter S, suctioning is not performed. And letter I, irritants should be avoided. So bawal yung mga citrus juice, bawal yung mga hot and cold fluids or liquids, and yung mga red-colored drinks like your cherry Kool-Aid. Okay, bawal po yun. The next laboratory test to be checked is the prothrombin time, and Letter S, again, side lying position. Okay, side lying position. Yung turn to side pala sa unahan, yan yung kapag nag-vomit yung patient. You must turn to side to prevent aspiration.